The Prioritising Protection report is about multi-agency responses to different forms of extra-familial harm, including criminal and sexual exploitation, serious youth violence and peer-to-peer abuse and intimate partner abuse between young people, looking at both multi-agency operational panels that kind of coordinate the response and the multi-agency strategic arrangements that sit above those panels. The report's important because I think a lot has been assumed about multi-agency responses to extrafamilial harm, and particularly the role of panels. But actually multi-agency child exploitation panels, sometimes they're called other things, and alternatives that are developing to them don't sit under a national policy that says how those panels should operate. And while a lot of people have looked at those panels for research purposes to understand local responses, the effectiveness of panels themselves are really under-researched in this field. They've kind of organically grown as part of the national response, but we don't really understand how they're being used, their consistency, or the role of safeguarding partners in facilitating that locally. So there are a number of key findings from the Prioritising Protection report, probably the main one being that there isn't a singular consistent safeguarding pathway or panel in place across England and Wales in response to extrafamilial harm. Everyone's doing things quite differently. And while most areas we engaged in the study did have a multi-agency child exploitation panel or some version of it, a good number, between 15 and 20%, had disbanded their panel or were in the process of reviewing it or putting something alternative in place. Where panels did exist, sometimes they were integrated into a children's services pathway, but more often they sat in parallel to it, used their own risk assessment processes, their own case oversight processes, and this meant that children being overseen by those panels sat outside of a traditional children's services pathway, and this was particularly true for children impacted by serious youth violence, who often sat in between all of those things. So they weren't often on a child protection plan due to serious youth violence, but they also weren't always being overseen by a multi-agency child exploitation panel. So they were then pushed into community safety, youth justice and kind of antisocial behaviour pathways. So we see a real inconsistency on the ground operationally, and then strategically that is also mirrored. Not every Safeguarding Children's Partnership or Board considered all forms of extrafamilial harm in its strategic planning. Some of that still sat much more with community safety procedures and strategic groups. So there's a real variation across the country, a lack of consistency, therefore, in terms of what children, young people, families and communities receive, and real questions about the usefulness of panels, particularly when they act as a point of duplication in local systems. I think given the reforms underway in England in particular, the report is a really important reminder of how challenging we find it to redesign systems that were never designed with extrafamilial harm in mind. A lot of the use of multi-agency panels were bolt-ons to systems that were predominantly focused on harm that was solely happening within family homes or family networks. So when we're undergoing this period of reform, it's really important that we don't repeat that process and respond to extrafamilial harm as a bolt-on to a system that's been redesigned. We need to consider extrafamilial harm now and throughout the reform process, so that the systems we end up with at the end of the reforms had extrafamilial harm in mind throughout, so that children unsafe within their families have an effective response, children unsafe beyond their families have an effective response, and children unsafe in both those contexts also have an effective response.